There is a molecule inside every single cell of your body that determines how fast you age, how much energy you have, how well your muscles work, and even how clearly you think. And right now, if you're over 60, your levels of this molecule have dropped by anywhere from 40 to 70% compared to when you were in your 30s. That's not a small decline. That is a biological cliff your body has been quietly falling off of. And nobody told you. What's more, there is a specific form of vitamin B3 that clinical research has confirmed can raise this molecule back up. And the results researchers are seeing in older adults are turning heads in laboratories from Harvard to Wake Forest University. I want to show you exactly what this is, why it matters so much for people your age, and precisely how to take it starting this week. I'm Dr. Sarah Mitchell, and this channel is dedicated to bringing you the latest peer-reviewed research translated into practical health guidance designed specifically for adults over 60. If you haven't subscribed yet, please hit that button now, because every single week I'm covering the science your doctor may not have time to explain. Now let's talk about what's actually happening inside your body. The molecule at the center of all of this is called NAD+, which stands for nicotinamide adenine dinucleotide. Your body produces it naturally, and it plays a role in over 400 enzymatic processes. Every cell depends on it. Your mitochondria, the tiny power generators inside each of your cells, cannot produce energy without adequate NAD+. Your DNA repair systems, which fix the daily damage that accumulates in your genetic material, run on NAD+. The proteins that regulate inflammation, sleep cycles, and metabolic function all require it. Think of NAD+ as the electrical current running through your body's wiring. When it drops, systems start to fail, slowly, quietly, in ways that are easy to blame on simply getting older. Here's the part that surprises most people. Research published in Cell Metabolism and validated across multiple institutions has shown that NAD+ levels in human tissues drop by roughly 50% between the ages of 40 and 60. By your late 70s, some tissues are running at only 30% of what they had decades earlier. This is documented biology, not speculation, and it explains an enormous amount. The fatigue that doesn't improve no matter how much you sleep. The muscle weakness that seems to appear gradually with no clear cause. The mental fog on days when nothing particularly stressful is happening. These are not inevitable features of aging. They are, in significant part, symptoms of NAD+ depletion. The vitamin that addresses this is called nicotinamide riboside. You may not recognize that name, and that's completely understandable. Most people haven't heard it yet. It is a specific form of vitamin B3, but it is not the standard niacin you might find in a multivitamin. Standard niacin must take a long, inefficient metabolic route before it can raise NAD+. Nicotinamide riboside enters your cells through specialized transporters and converts to NAD+ through a much shorter pathway. It works faster, it's absorbed more efficiently, and critically, it does not cause the skin flushing that makes many people stop taking regular high-dose niacin altogether. I want you to take a moment and comment below with your age and one symptom that you've been chalking up to getting older, whether it's fatigue, brain fog, muscle weakness, poor sleep, or anything else. I genuinely want to see what's happening in this community because I think the patterns will tell us something important. Now let me tell you about Margaret. She was 72, a retired teacher, and had been dealing with what she described as relentless exhaustion for about 3 years. Thyroid, normal. Iron, normal. Vitamin B12, normal. Her doctor told her it was simply the natural progression of aging and that she should try to pace herself. Margaret started taking 300 milligrams of nicotinamide riboside each morning with breakfast. Within 6 weeks, she was completing her full morning routine without needing to rest midway through. Within 3 months, her inflammatory markers, specifically her C-reactive protein levels, had measurably decreased. Her doctor called it unexpected. The research would call it predictable. Here is where the clinical evidence stands right now, because I want you to understand this is not fringe science. A 2024 study published in the journal GeroScience, conducted by researchers at Wake Forest University School of Medicine, ran a randomized placebo-controlled trial of nicotinamide riboside in older adults with mild cognitive impairment. Their findings confirmed that NR supplementation safely and measurably raised NAD+ blood levels in participants. A 2023 twin study published in Science Advances found that NR improved muscle mitochondrial biogenesis, meaning the muscle cells were getting better at generating energy, along with positive changes in muscle satellite cells, which are the cells responsible for repairing and regenerating muscle tissue. That is significant for any senior dealing with gradual muscle loss, which doctors call sarcopenia. But here's what I find most remarkable about the recent research. A pilot randomized controlled trial published in GeroScience in 2025 studied sedentary adults over the age of 55 who had elevated blood pressure. When NR supplementation was combined with regular aerobic exercise, the combination produced measurably better results than exercise alone. This tells us something important about how this molecule works. It amplifies the benefits of healthy lifestyle choices rather than replacing them. This next point could matter more than anything else I tell you today. NAD+ is directly responsible for activating a class of proteins called sirtuins, sometimes referred to in the research literature as longevity proteins. Sirtuins regulate how your cells respond to stress, oversee inflammation pathways, and manage DNA repair. When NAD+ is depleted, sirtuins essentially go dormant. They cannot do their job. When you restore adequate NAD+ through supplementation, those proteins become active again. Research supported by the National Institute on Aging has shown that sirtuin activation is associated with several favorable cellular aging markers. This is the biological mechanism behind why the results in some of these trials have been described by researchers as more significant than initially expected. What about brain health specifically? Your neurons are among the most energy-hungry cells in your entire body, and they are particularly vulnerable to NAD+ depletion. A 2023 study published in Aging Cell found that oral NR supplementation raised NAD+ levels and also lowered certain biomarkers of neurodegenerative pathology in extracellular vesicles derived from neurons. The researchers were clear that this does not establish NR as a treatment for Alzheimer's disease, but maintaining adequate NAD+ appears to support the biological conditions under which the aging brain can function and repair itself more effectively. That distinction matters, and I want you to understand it clearly. Let me tell you about Harold. He was 69 and had watched his grip strength and walking pace decline steadily over 2 years. His physical therapist had told him age-related muscle loss was simply progressing, and that maintaining current function would be a realistic goal. Harold added nicotinamide riboside to a light resistance training routine he was already doing 3 times a week. After 12 weeks, his functional strength assessments improved meaningfully, enough that his therapist revised the goal from maintenance to modest recovery. A 2025 systematic review and meta-analysis published in the Journal of Cachexia, Sarcopenia, and Muscle analyzed randomized controlled trials of NR and NMN supplementation in adults over 60 and found evidence of positive effects on physical performance, particularly when supplementation was combined with exercise. That is Harold's experience reflected in the science. Now let me give you the exact protocol so you know precisely what to do. The starting dose supported by most clinical trials in older adults is 300 milligrams of nicotinamide riboside per day. Some trials have used 500 to 1,000 milligrams with acceptable safety profiles. But start at 300 milligrams and stay there for at least the first 8 weeks before considering any adjustment. Take it in the morning with breakfast. NAD+ is involved in cellular energy production, so evening supplementation can occasionally interfere with sleep in sensitive individuals. Taking it with food also reduces the chances of mild nausea, which is the most commonly reported side effect and is usually temporary and minor. When you go to purchase this, look specifically for products labeled nicotinamide riboside chloride or those using the branded ingredient true niacin. This is the form used in the majority of published clinical trials, and it has the strongest evidence base. Look for third-party testing on the label. You want to see USP verified, NSF certified, or informed sport certification marks. These tell you that what's in the bottle actually matches what the label claims. You can find reputable products at CVS, Walgreens, or Costco, or search nicotinamide riboside 300 milligrams third-party tested on Amazon to compare options. Expect to pay between $30 and $50 for a month's supply of a quality product. Plan to take this consistently for a minimum of 8 to 12 weeks before evaluating results. Energy and sleep improvements may appear in the first 4 to 6 weeks. Muscle function and inflammatory marker improvements typically require longer-term supplementation. This is not a supplement where you try it for 2 weeks and make a judgment. Give it time. Before starting, please speak with your physician, especially if you take any blood thinners, chemotherapy agents, or immunosuppressant medications. NR has an excellent safety profile in healthy older adults across the clinical literature, but your doctor needs to know what you're taking. If you experience persistent nausea, unusual skin changes, or any unexpected reaction, discontinue and consult your doctor right away. One final point. NR works better in context. Pair it with regular physical activity, particularly any resistance training, and aim for adequate protein intake. At least 1.2 grams of protein per kilogram of body weight each day. These aren't optional add-ons. They are the biological partners that allow what NR does at the cellular level to translate into real functional improvements you can actually feel. NAD+ decline is one of the most consistently documented hallmarks of biological aging, and nicotinamide riboside is the most clinically studied, safest, and most accessible way to address it. 300 milligrams each morning, a quality third-party tested product, and at least 8 to 12 weeks of consistent use. Now I want to hear from you. Leave one of these 3 comments below. Comment, "Starting this week," if you plan to try nicotinamide riboside. Comment your current energy level on a scale of 1 to 10 so we can track where this community is starting from. Or comment, "Sharing this," if you know someone over 60 who should see this video. Your comments genuinely help this channel reach more people who need this information. If this gave you something useful today, please subscribe so you don't miss what's coming next week. I'm covering one of the most common combinations of blood pressure medications that research now suggests may quietly accelerate kidney function decline in seniors. And the findings are specific enough that you'll want to know this before your next appointment. I'm Dr. Sarah Mitchell. Take care of yourself. That's exactly what you deserve.